That's
We need to
last
do
month.
the agenda topics approval.
What's that?
The third bullet point, approval of agenda topics.
Oh, yeah, the approval of agenda topics.
We don't have any changes to present.
Yeah, motion to approve the agenda topics.
So moved.
Second.
Roll call.
Mark Scranton,
Yes.
Jane Hack,
Yeah.
Jeff Emler,
Yes.
Debbie Hill,
Yes.
Dr. Brent Jenger,
Yes.
Dr. Janet Patterson,
Yes.
Okay, moving on, approval of previous meeting minutes from October. So motion,
Well, motion to approve the minutes from the prior meeting.
I second.
roll call.
Mark Scranton,
Yes.
Jane Hack,
Yeah.
Jeff Emler,
Yes.
Debbie Hill,
Yes.
Dr. Brent Jenger,
Yes.
Dr. Janet Patterson,
Yes.
Okay, communication, COVID-19 update.
Okay, I did want to let you know, we did receive some communication this month as well. Several envelopes from Macon County Board of Review, and they were all assessment appeals filed at the Macon County Board of Review requesting a change in assessed value of $100,000 or more. We will keep all of those on file, but I did just want to make you all aware. All right, and then any questions about that, or do you want any additional information given with that? Okay. All right, and then COVID-19 update, not a lot of major changes since last month. For contact tracing, the numbers are going up, and they are seeing that across the state, including throughout our region. They are watching to see if it is another surge or not. Right now, Macon County is at 216 for 100,000 cases. The target is 50. So we're significantly over that. All of Illinois is still considered to be in high transmission, and most of the country is also considered to be in high transmission at this time. Mass vaccination clinics, we're doing it all now. We started pediatric vaccines ages 5 to 11 today, and that was a really exciting moment to have those kiddos in here. Things went really, really smoothly, and so they're going to add more spots to the already filled Thursday appointment slots. So they'll be having more opportunities for children to come in during that time. And otherwise, things are going relatively smooth. I do have an update later on about those grants that I will give you. Any questions for me about any of that?
Okay, presentation, acceptance of financial report.
Sure, for that.
Hello, can you hear me?
Yeah.
Okay, this report is as of the end of October, so we were 92% into the fiscal year. Total ending fund balance was at 5.6 million. Total revenue was at 7.4 million, which is 76.7% into budgeted revenue, and total expenditures at a little over 7 million, which is 72.8% into budgeted expenditures. Any questions?
Anybody any questions?
Yeah.
Motion to accept financial report. So moved.
Second.
Roll call.
Mark Scranton,
Yes.
Jane Hack,
Yeah.
Jeff Emler,
Yes.
Debbie Hill,
Yes.
Dr. Brent Jenger,
Yes.
Dr. Janet Patterson,
Yes.
Review and approval of department expenditures. Got anything in here, Brandy, that we need to?
Just if anybody has any questions, as Cherie had given an update to the board a couple or few months ago now, she did make these reports. She pulled the more detailed version so that you all could see that in case you did have specific questions about what an expense was. So if you have any questions after having a chance to look at that, we're definitely available to answer those.
Hearing no questions, motion to approve expenditures.
So moved.
Second.
Roll call.
Mark Scranton,
Yes.
Jane Hack,
Yes.
Jeff Engler,
Yes.
Debbie Hill,
Yes.
Dr. Brent Jigger,
Yes.
Dr. Janet Patterson,
Yes.
Grant applications for review.
We do not have any this month. I will tell you, just for especially the newer board members, just so you know, that was added onto our board agendas several years ago. I can't remember exactly how many, but the purpose of that step was if there were new grants that were added in, new opportunities, that we answered a questionnaire and submitted it to the board so that you could review it, see, make sure it's not a duplication of efforts with another organization, make sure it's something that the board felt fit the mission, make sure it's something that our staff could handle workload wise. So we don't put everything through that process. It's just anything that would be new or different than the norm. So just so you all know, we do have grants going through every year, but the ones that we do for review are just the newer ones. That's all I have for that part.
Okay, department division reports. I did see something in here where the health department's not intending on starting STD clinics back up till the middle of next year. Is that correct?
We're not, that is our goal deadline. As a reminder, we do have to have a provider for most STI services. We are doing STI services right now. Any reported communicable disease, including STIs, we do follow up on, no matter where they're tested and diagnosed, treated, et cetera. So we are always working STI cases all of the time. That hasn't stopped throughout COVID. What went on pause because of staffing at our agency and partner agencies was having a provider in here to do actual exams and tests in the building. We have been looking at something called the brown bag project, which is basically people could come in and do a urine. That's something that we could potentially do without a provider, but anything else that we would do to require a provider has to come from a provider external from the organization. We have been reaching out to our partner that we partnered with before COVID, asking them if they'd be willing or interested to come back, and we still haven't gotten response from that, but it's sort of in some ways out of our hands. So our goal deadline is to have that implemented by July of 2022. We also have partnered with another agency to come in and provide services and consulting and counseling for people in the building. So we have STI services. I just want to make sure, I guess, to give more clarification on that, we're just not doing those actual exams in the building that we were doing before COVID. And we partnered with Crossing. They had a provider that came over here to be able to offer that here in the building.
So what kind of things do you do if somebody has an STI? Do you do?
There's call follow-up, notification, getting a hold of them if there's some kind of treatment, medication that they would need, all of those steps. And then we follow, track, report all of those to the state. We also have, as of right now, we have an HIV Provide Grant. That's something that we got from the Illinois Association of Public Health Administrators, and we've continued that through COVID as well.
So what would it take to get clinics back open again?
The top thing is having a provider and having staff for that. Provider is something that would have to come from somewhere else. We don't have a provider in-house.
So who was doing it before COVID?
Crossing.
So we need to facilitate getting that done with them. And then what's the staff doing that was handling the STIs that aren't doing it now? What are they doing?
So Crossing, I've already reached out to. We've already had a meeting and some follow-up communication about not only bringing back STI services, but also making them more comprehensive. We've pitched some ideas to the state as far as what we could do that the state has turned down that would make it better for the public, but we have already started that communication with Crossing about getting them back. And then as far as the staff that were doing that before, we've lost some staff through COVID that were doing that before. So now the nurses that we have in the building, they are doing all the other immunizations. They do TB tests, they do foreign travel consultation, they do that STI and communicable disease follow-up. They do anything in the lab that is required for us to do, plus they're assisting with COVID vaccinations as needed, flu vaccinations. So they're basically running the rest of the operation. When we did have STI clinic before, it ran for about 2.5 hours for 2 days of the week. So the people that were working on this, that was like about 5 hour a week thing.
Well, my concern is, I brought this up 2 or 3 months ago about getting these clinics back going again, and now we're sitting here today. The problem still hasn't been resolved, and now you're talking about another 8 months down the road is the goal to try to have this back running again. I don't think that's acceptable, because one of the responsibilities for the health department is to promote the well-being and health of the public at large. And when you look at the statistics that you guys have had running, STIs haven't stopped because of COVID. And I'm concerned that we're clogging up our emergency rooms and doctor's offices, express care, and other places for things that the health department ought to be taking care of. And I'm really kind of frustrated to see that we're not getting this going again, and now you're talking about the middle of next year before this is going to get going again. And I don't know how the rest of the board feels, but I got a real problem with this, because people were here doing this before all this happened, and it seems like that we're focusing so much of our energy on COVID and COVID-related issues that the rest of these illnesses, infections are just kind of being tossed aside like they don't even exist anymore. But yet the numbers reflect that we have a lot of cases in Macon County, and this is going on every single month. And I don't feel like we're doing our due diligence to try to resolve this problem and get back on track with having a clinic open to the public, because there's a lot of people that don't have other means to do it. I got an issue that we're having people that have these types of situations that are being pushed off to try to get into crossing, which then is adding more burden to their schedule of staff and personnel trying to deal with other cases for other things they have coming in. And then these people are potentially going to the ER or whatever else they might be doing to try to get treatment, or they're not doing anything at all, which is a larger problem because you're just spreading these things around. So I would challenge the staff to get a lot more aggressive on trying to get something worked out with the provider and get staff back on board. But I don't have any desire to see this drag out till the middle of next year. That's not acceptable to me.
Well, and I agree with you. And I will say, at the health department, we have not had the luxury of getting to ignore other things. We certainly have had to maintain and continue our focus on everything else that we've done and add COVID on top of it, which is why we have had some turnover and why we have had staff that have worked, an extraordinary amount of hours to get everything done. I've reached out to 2 agencies that could send a provider. I don't have anyone that is agreeable to do that. I've reached out more than once. So if you could help move that in some way, then I would, be grateful for that. But I can say my staff is trying and I'm trying. So we'll continue to do that, but I can't force them.
What is their objection to being back involved again? I mean, they were doing it before. What's the reason for not wanting to do it now?
Well, I can't necessarily say there's been an objection. I just haven't really even gotten a lot of feedback. We met with Crossing and me and the nursing team because we were going to try to partner in a way that we get certain medications as the health department to treat some STIs. We don't have a provider. They have a provider, but don't have access to the medication that we have access to. So what we tried to do, and this was months and months and months ago, is discuss with them, and they were very agreeable to it. I think it could have been a great partnership where their provider would see people in their building, we would give our medication, and we would all be serving that same population. One of the positives to that is that people, while they are first diagnosed, if you can treat them for at least some of the STIs, if they have more than one, or if they have an STI you can immediately medicate for, then that is ideal. But if they leave and then you call them to get their medication, or you have to send them somewhere else, then they may never come back, or you may never be able to reach them via phone. So it would have been a really great partnership. However, the state did not allow for us to do that because they would not allow our medication to be used in any other building or taken somewhere. It has to be used here. So I think that would have been an ideal way to move forward. So after that, I did follow up with Crossing to ask, would you be interested in bringing a provider again? We want to get this going. And then also had reached out to SIU prior to COVID, we had a lot of conversations with SIU about partnering with our dental clinic expansion, and then also in our nursing division for more clinical services, and also the possibility of bringing someone over here for behavioral health a couple days a week or so. So we were looking at partnering with them in a lot of different ways. They've had some changes in leadership. They obviously have a lot going on too. So if Crossing isn't agreeable to doing it, they may be an option, but I can't force them. So
if they walk in, without an appointment, right? They walk in, you can see them then?
here,
Uh-huh.
well, right now we don't have a provider, so we're not,
Provider being a
performing.
doctor? Is
Yes.
that- Or a nurse?
or yeah, a provider that's qualified.
Is it SIU Family Medicine you've talked to? I mean, I can maybe help facilitate that, but which department is?
We were talking to Iris, and then of course working with
That's in family
Annette, and I know
medicine.
she's retired since,
Okay,
but very involved with talking with Iris. And then some of their other leadership staff, I can't think of their names off the top of my head, but, you know, we would love to be able to offer that, but unfortunately some of it is out of our hands. So we're trying.
Do
And like I
do
said-
they donate their time or do you pay them as a provider?
So the way that it worked with Crossing, without looking at the contract, was that they would bill for their services. So while they were here, they were essentially using our space to see the patients. We had some staff that were working, so some, you know, reception or nursing staff, and then they had some staff that they would bring with them. They would bill. So we wouldn't get anything for it, but we were able to provide the service in our house, basically. But they would get
And they
everything that they billed for.
Bill you?
No, they would bill insurance, Medicaid, like whomever was the payee for that patient. And then we didn't bill anyone for anything. They were completely billing, they were their patients in that setup.
So we don't have the ability to contract this through another medical provider other than Crossing?
I mean, there's a possibility that we could, if we're contracting with a service, that's going to look different, obviously.
Well,
you know,
if we don't have the
budget.
staff here to do it, we gotta pay somebody, I would suggest we find a way to get it done, because, I mean, you're talking 1,400 cases over the course of the year, that's over 100 cases a month, and we're not taking care of these people, and this has been going on for a year and a half now, and you're talking about another 8 months down the road. I got a serious problem with this, because this is one of the things that I think people rely on coming to the health department for, and my fear is people are either not getting treated or they're going to the ER for something in the scheme of things is a pretty novel disease to get treated, and the ER is facing their own challenges. I've been there 3 times in the last month myself and seen firsthand that they're struggling with staffing issues and everything else themselves, and I don't think we should be plugging the system up by sending people there for this type of a situation. So I'm going to ask that you guys come back next month with something to show where you guys are going with this, because I don't think it's been getting enough attention. I brought it up 2 or 3 months ago, and I can't believe that we can't find somebody to come in here. You're talking 5 hours a week. There's got to be somebody that can come and do this even on a part-time basis. I would think we've got enough medical people in Macon County. I can't believe somebody can't come in here as a nurse practitioner, you know, whatever, working a side job outside their normal job or whatever. But I would like to see something
Is it a
movement on this.
Is it a funding issue? It sounds like the situation you had before was really unfunded. If they were coming here and then billing for their services, you didn't have to pay anything, right?
We did have some staff time that was committed to that, to supporting what was going on down there.
But if we
Like
do,
that.
like Mark says, if we hire somebody to come and do that, we probably not funded,
No, that's not.
budgeted that, have we?
Right, no, and that's not in the budget right now, but that's certainly something that, you know, if the board wanted to dedicate health fund dollars to that, we could go through the resolution process of doing that, getting a contract approved, all of that. We could certainly go down that route if that's something that the board wishes. I really though, Mark, we have not ignored these people, so I hope you know that. We are providing them services and support, and we have implemented other services and partnerships during this time. So even, and I agree with you, you know, STIs are something that we as a health department have done forever. So it's certainly not something that we're ignoring by any means, but we can definitely bring something back next month, maybe a really detailed report about everything that the team has been doing. And then I can look into seeing if there's a way to contract with a provider that would come in here.
I just think we need to have some movement on it. I don't think waiting 8 months to fix this is something we want to do. I don't think we're not doing right by the public.
Well, and just, again, we're not waiting until July to work on that. We're already working on that. My goal is, you know, no matter what, to have something implemented, started, whether it's a contract that we need, a resolution, a budget, funding, whatever, getting a different partner from somewhere else, and that's all started and those services are occurring by July 1, not waiting until July 1 to work on it.
Okay, anybody else got any questions on any of the reports? At all? We're gonna review the food truck thing under the other category, then am I going over it right now in this?
No, I have that under old business.
Okay, all right. Okay. Anyway, employee recognition for October anniversaries. We need November anniversaries, don't we? Have that in here somewhere?
It's a typo. It should be November.
Oh, okay. Thank you for correcting that then. Janelle Hockaday, 15 years. Sue Borowitsky, 15 years. Kathy Crum, 11 years. Tiffany Sutton, 5 years. Lindsay Musterman, 4 years. Fred Cook, 1 year. Colleen Murphy, 1 year. Thanks for your service. Okay, old business, email addresses.
Okay, I did send an email out about this. Just a reminder, if your email is not set up, please get that done because we're really trying to get everything transitioned to using those. If you need help, I did send, and I can give it to you again if you need it, the IT email and phone number if you need them to help you get set up in any way.
What's the phone number for that?
423-6988, extension 1139.
Okay, I still can't get mine to work right. And I did not get the meeting minutes, or I did not get the board agenda for this month. So it's the email the other day. I got the list on Friday somehow.
It was sent to your board email, that's why, so.
Yeah, that's kind of what I assumed might have happened. Okay, any more questions on that? COVID-19 contact tracing mass vaccination grant update.
Okay, this is just a fairly brief update. As we had noted last month, we did get an increase and amendment to the mass vaccination grants. Our increase was of $296,800 for a grand total with what we already had of $611,800. The contact tracing grant, they did notify us Monday during our IDPH call that the funds will not be extended or called a contact tracing grant after that December 31st end date. What they're going to do is give us funds that are going to be called something else that have less restrictions on them. And they're supposed to be getting us out more information soon is all that I have. They also did not share with us what the contact tracing expectations would be specifically. They did say and made it sound like they would be the same. But all health departments are in the same boat as us right now with trying to plan without really having all of that information. The feedback that health departments gave the state was that they wish the funding we had gotten would be less restrictive so we could actually use it for more public health infrastructure. And so I believe that is the intention with this change, the way that the funding is going to work after 12/31. So I will update you as soon as I know more, but that's what I know right now. That again presents the situation with staffing. We have continued to be very transparent with them. We have had, more people that have left that we knew were probably going to leave that had other opportunities that were basically going to be awaiting them, or they finished school and, were moving basically into their full-time job. So as of right now, that is the update that I'm going to give them on Thursday during their call. But our intention, if that funding continues and expectation continues, is that we would put in the budget to continue the positions that we need.
So the funding runs out this month or next month.
Next month, 12/31.
So we're gonna have to wait till we come to December's meeting to find out if these people are gonna have a job in 2 weeks.
Well, I think, and tell me if I'm wrong, my understanding was from the board that if we aren't going to have funding, that there was a desire to possibly use health funds to cover those positions if the contact tracing expectations continued. Is that correct?
No, I don't believe so. I think we discussed about the fact that we did not want to take money out of the health fund to pay for contact tracing, that the money was going to be, additional money wasn't going to be made available. My recollection of the conversation, because we didn't want to take money out of the health fund budget. We could go back and check the record, but I'm pretty sure that's what we discussed, because we were talking about not taking money out of that fund to pay for contact tracing.
Well,
So-
it's going to ultimately be up to the board, not to me. My understanding is that you wanted these people, if they were going to have a job, you wanted for them to know that after the first of the year, their position would be funded, whether it was IDPH grants or not. So if I'm incorrect, obviously that, understandable, but I do, we will have more information from the state. And as we've discussed, they do sometimes give it to us late in the game. And so, I can do whatever the pleasure of the board is at this point, but all of these staff have been told since they were interviewed that their positions are temporary and they are grant funded and they could end, very quickly. Sometime, and they were all told the state usually gives, notice very close to when a deadline is, so they may not know until close to that point. So they have been told in a very honest way from the very beginning that this could end and end abruptly. So I'll do whatever the board wants to do. Generally, if funding ends, usually we just don't have those positions anymore. But with this being a core essential service, if as a health department, our responsibility is to contact trace, which pre-COVID and during COVID, we do have to contact trace communicable diseases no matter what they are. So like if there's TB case, for example, we have to contact trace that. And so that would have to be something the board would decide, because if we're going to go against the rules of what we're supposed to do as a local health department, that could be problematic. So I could definitely.
How many contact tracers are you employing right now just for the COVID?
Well, right now we have 33 people that are trained, but then we also have people who are trained as contact tracers throughout the building who can assist if there is some kind of surge. We did that back before we were able to hire people. So we have a lot of people in the building trained who their job has nothing to do with contact tracing
but
usually.
Those 33 people are the ones that are specifically.
They are contact tracing and mass vaccination. So those are the people that are working partly contact tracing and partly working our vaccination clinics for COVID. But those are people whose positions are funded or primarily funded with that grant funding. Yeah. And
So
that includes
we're gonna have to
all
wait
of
till
our,
next month to find out, and these people are gonna be looking at Christmas holiday and everything else, and they're not gonna know if they got a job until we have our next board meeting, basically. From what you're telling me.
right.
Is your confidence level pretty high that there's gonna be some type of funding? It's gonna come down the pipe? Sounds like it.
Yes. I will say, I'm never going to guarantee the state does something, because the state does not promise
Sure.
a lot. And then sometimes they're wanting something from, the governor's budget office, but then they don't get it, meaning IDPH. They have assured us in all health departments for a while that there's going to be money. The news on Monday was a shock to everyone on the call that said this isn't going to be called contact tracing after 12/31. That money's going to end. You won't have an extension to use it, et cetera. That was a shock, because that's the first we've been told of that. And then they did say there would be more money, which they have been saying they were going to try to get additional funds to be put through public health, because of the fact that public health budget has been cut or just underfunded for years and years, and decades. And so this is just something that showed, hey, public health really needs funding. And so I do feel confident that we will get it, but I'm not going to guarantee on behalf of IDPH, because sometimes I don't know what they're doing until they do it. What I do feel really confident about is that usually IDPH will say, hey, you're going to get this money. it either starts in 2 weeks or it started 2 weeks ago. We need you to fill out this budget and get it to us in 1 week or 3 days or whatever it is. And then we have to scurry and figure it out. So that's what I do know, is that generally these things do happen at the last minute. We do find out the last minute. And that's why I have told the staff since the interviews that I was in, that we may not know until we know, and we have to take action right then and there.
But it's a grant, so we have to, as a board, approve that then, right?
If there's a new grant,
Yeah,
yeah, we would bring that to you.
that's what I'm saying, so we have to have it by next board meeting. Okay, just a comment on that. The way this stuff's being done, you just shine the light on how discombobulated this whole process is. I talked to somebody the other day. There's places out there that have piles of COVID money that they were given that they're sitting on. They don't even know how heck they even spend it right now. I got told the other day that the college is giving out $300 for every person that shows within a window of time where they got vaccinated, because they got this money and they're limited on what they can spend it on. It has to be very, very specific. So they got to use this money or they got to give it back. And it's, we're sitting here talking about need money. They're sitting over here saying, hey, we got this pile of money. We don't know what to do with it. We can't do this with it because it's not allowed per the guidelines or rules or whatever you want to call it. It's frustrating, but you know, when you're dealing with state and federal government, you don't have a lot of control over what they decide to do. But I mean, I know these people know it's a temporary job, but when you get into the holidays and everything else is as rough times as everybody's been having, I hate to see people be put out of a job regardless of what it is. But I think it's up to them to give them some kind of a notice of some type that they're not going to continue employment through the end of the year.
Well, right now, if the expectation from IDPH remains the same, I hope that they will have a job and that they'll have a job into 2022. And I mean, I understand and feel your pain because I know these people and I've been working with them for a long time and I care about them. And I'm the one that is going to have to let them go if that happens. So I completely agree with you, and my desire would be to keep them on, because I also know my core staff cannot do all the contact tracing. So if I don't have that team, I am in big trouble, and we're back to where we were last spring and summer, which is not good. So I agree with you. And also, I mean, we also have, the county has, $20 million too. So, I mean, we have put in requests to get some funding support from them, and that's certainly a direction that we could go as well.
$20 million for what?
It's their ARPA funds, the American Rescue Plan Act funds that we had talked about.
Okay, but what's that money allocated for? It's not allocated just for COVID.
No, it's supposed to be used for public health infrastructure and for other ways to support the health and well-being of your community. I don't have the wording memorized, but that's what it's supposed to be for.
Well, if we had to do that, I'd tell you get some grant money to get us a provider in here to take care of our clinics.
Well, maybe you could help us convince them of that, because that would be fantastic.
Just a thought. Okay, anybody else, got anything else on that? Okay, Helmer contract update.
I just wanted to let you know that passed all the way through county board. So that's the only thing I have for that.
Okay, fiscal year 2022 budget update.
That passed as well. So we're good on that.
Okay, what's in the update?
Okay, so Kathy got out the letter, with the stipulations per your direction. She did work with Wits End, and as of yesterday, they were inspected, passed all their city inspections, passed our inspection. I don't know what date they're actually opening, but they were all taken care of by us yesterday. I mean, it's been an ongoing thing because there were some things that weren't in their original plan that Kathy had to ask for or wait for or get from their legal. But as of yesterday, we had a team that went out late in the day to try to beat their deadline with their liquor license, which I was very grateful that they did that, to not, cause them any delay, and they got them taken care of.
Oh, the liquor license.
And just a note.
Extended it.
It was gonna
Yeah,
start at 5, so they
extended it once.
They
So
passed.
just a note though, I would encourage you, I know this was kind of a challenge for the board and for the staff, but I personally have been out there and observed the changes they've made there. I would encourage everybody to take a little bit out of their schedule sometime in the next week or two and go by there, whether you choose to partake of patronizing them or not, but just go by and take a look at what they did, because I can tell you, I was I was really shocked. I
It's
mean,
beautiful.
they've done
Yeah,
They've done a tremendous amount of work. I mean, you can tell they put a lot of genuine effort into it. I mean, they even had the parking lot resealed and restriped and cleaned up
It
stuff
does
around
make
the outside of the
sense.
building.
Seriously.
And, yeah, I mean, you
It
would,
is so clean.
you would not even recognize it. I don't even think you'd recognize the place because they painted, I mean, the outside of the building's not painted. I think that's about the only thing they probably didn't do.
But I mean, they've done
Inside
restructured
the building,
walls.
they went through the thing top to bottom. I think they took all the comments that were made by staff. They took that stuff to heart, and I think they went above and beyond what they were even
It doesn't look
required
like
to
the same
do.
place.
That's just my opinion, but I think if you guys saw what we saw before and you went out there and saw what it looks like now, I think you'd be like, wow, they really, not only did they commit a lot of financial resources to get this back on track again. I think it's a whole different change in attitude and just everything in general. And I think the right leadership is in place now. I think they'll do a good job going forward. So that's just my comments on that. Mobile food truck ordinance update.
Okay, so I just want to let you all know that after our last meeting, when this was approved, we did get it sent over to, for Macon County Board to go through that process. We got some clarification from Mike Baggett with the State's Attorney's Office on if it needed to go through EEHW or just the SRO committee. So we were able to get that on the agenda for SRO, and that meeting was held on November 2nd. It was approved at that meeting. And then we did get it to the county board secretary that night just to make sure we could get it on the November meeting. Of course, trying to get it as soon as possible for our business owners, hopefully by that January 1 date. I went to the meeting. Kathy also went just so we could be available to answer any questions that night in case any came up. The meeting was November 10th. And when we got to that item on the agenda, they did announce that they were tabling it until next month. I didn't get any other information at that time and hadn't heard anything before that. So I did email a couple of people just to ask for any follow-up with that, what the next steps are, or if there was some kind of question or concern that we needed to address, or just basically kind of what happened and what do we need to do at this point. I did get a response from Kevin Greenfield, the chairman of the county board, and he did say that some board members had not had a chance to read it, so they just wanted more time. He did also ask that in the future we get things there as soon as possible. I am going to follow up with him directly, but I did want to clarify with all of you that we did send all of that over immediately. I don't know when things were sent to the county board, but in every spot, we had it to them immediately, and we did send that information to the state's attorney's office in July. And that's where it's been. I know Kathy's been updating all of you via her division report, but I did want you all to know, just so that, you know, kind of on our end that we've done this way ahead of schedule and trying to support those businesses and get it taken care of for 22.
Well, I wouldn't say it was done way ahead because we just got this information at last month's meeting and had to review and make a decision on it. And I can tell you myself, and I hadn't really talked directly with Kathy about it, but I know we brought up some questions on some things we asked to maybe have changed or modified before this got presented to the board. I never saw an updated copy to reflect whether or not the things we discussed last month's meeting were done, but I think we should have had more time. It has no reflection on the staff, but just trying to jam this thing through the county board to get it to the January deadline. I don't care about that because I started interacting with people that didn't even know this was even going on until they saw stories about it in the media. So the public didn't really get a chance to really comment on this or provide any kind of response or feedback or ask questions of anybody of something that's already been decided on, that's already been passed. And the things that I heard from people was making sure businesses are only going to be in place for 1 week at a time. I know that's something we did talk about. Her and I even talked about it. We couldn't even agree on whether it was 1 week all the time or if it was 1 week just on the non-seasonal stuff. And then again, we had a discussion about the 200-foot issue, and I wasn't even sure where we finally landed on that, and I thought Kathy was gonna provide some clarity in how that was worded in the ordinance. And I haven't seen an updated copy, so I don't know what was presented to the county board, if any of those changes were made or not, because I can tell you, I've just driving around town, I've noticed probably a half a dozen different places that probably are not gonna meet this new criteria. And I don't think it's fair to the restaurant owners that have buildings or the food truck people, because they're gonna think it's business as usual. And I'll just give you an example of one place. It's on Pershing Road. You got a permanent building and you got a food truck. They're literally from here to the parking lot from each other. That's not gonna be in 200 foot. So I don't know. I wanna make sure that we have made some modifications. If we're sending this through to the board, county board, for them to vote on it, and we go back and look at something, see something we don't like, and we wanna go back and change it,
My question is.
we can change it down the road, but I'd rather fix it before it gets all the way through. And I don't know what was changed from last month, because I haven't seen a copy of anything updated, so.
My question is, when you have, are you gonna put a cap on these food trucks? Because you don't even have enough inspectors to inspect restaurants, let alone going to all these food trucks, which are high risk as well as my place. I don't understand how we can have that many.
Yeah, okay, so I know there's several questions that have been proposed. So there is not a cap on the number. I think that would be similar to telling businesses they can't open, which would be obviously the opposite of what our place is, and also what we need as a community, what our economy needs. So there's no cap. As far as staffing to figure it out, I mean, if there was some kind of explosion of number of businesses, then that could possibly merit having to add another staff person. At this time, we expect that our staff would be able to handle it. So we don't see that that's an issue, but sometimes you have to just see how it pans out, and if you need more staff, you have to look at the budget. Can we support more staff? Do we have enough, permits coming through that we can actually fund another staff person, et cetera? So right now, that for me is not a concern. We also have in the past year brought on 2 new people that are environmental health specialists. So the one obviously is trained on her own. The other one is trained and getting close to be on his own if he's not quite yet, which he might be. But so that is going to be more people to help share the load. We did have a smaller group of people doing all of it, which then again, then they're doing more work, putting more hours and all of that. So I'm really hoping where we're at now, if we can maintain staff, which is very difficult to even get environmental health staff at any health departments, let alone Macon County. So I think I'm really grateful that we have a really great team. I'm not worried right now about what their load is going to look like if we can maintain the staff that we have. Mark, to get to your questions. Okay, so the first thing I want to say is, as far as, getting sent out to you, we had our board agenda ready to send out to all of you, approved, ready to email by Lakia, everything. And we got the email from Mike Baggett at the State's Attorney's Office. He'd had the information since July, and Kathy had followed up with him many, many times to ask him for it, because the goal was to have it started by January of 2022. Because we got it by the time the agenda came out, we made those edits, we added it all in and got it to all of you. If there's ever a situation where you don't feel comfortable voting, you should definitely say that as a board member. But it was not us trying to cram something. It was us trying to, 1, get something done, and 2, again, support businesses that are trying, to do this. I know Kathy said several times she was really trying to make it so that it was fair to brick and mortar and mobile food trucks, et cetera. So we weren't trying to cram it, and I understand all of you may have only had from Friday to Tuesday to read it, but we can't control legal. We've really tried to get them to respond more quickly. And I mean, Mike Baggett even to me separately confirmed that he understands he was a bottleneck in this process. So I'm not trying to throw anybody under the bus, but we can only get things to you when we get it from legal. So we're trying to do things right by having legal look at it before we push it through any processes. That covers all of our butts.
So just to clarify what you're saying, you're telling me that he's had this since July and we just got it in October?
Correct.
So it's taken 6 months to get an opinion on an ordinance that we get presented with and have to review it and decide at one meeting.
Yes, or you could have, as a board, decided to wait until the next meeting.
I think our
Like-
conversation we had was we were okay with the ordinance overall, and I thought it was a good idea to get it done, but I think that we had some questions in there on either clarifying the things that I'm bringing up again tonight or some modifications being made. So my question to you is, did any of those changes get made? And if so, do we have a copy of that? Was that what was sent to the county board? That's what I'm asking for a little bit of guidance on, because I don't know what the final resolution looked like.
And I have that here to answer as well.
If it's what we voted on, then those changes didn't get made.
Okay, so what you all voted on, and I did go back and watch the meeting more than once just to make sure I was completely clear on it as well. During the discussion, Kathy did offer to add clarity or add changes if the board directed her to do that. The board did not direct her to do that. When the 200-foot discussion ended, the way that that finished was that it was, let's just see how it goes. We'll see how things go from the public. We'll see how this actually pans out implementation wise. And if we have to make edits later, we can. And the questions were asked, can it be edited anytime through the year? Do we have to wait until next year? And if we do make changes during the year, can you push those upon the people who are currently holding a license, or do you have to wait? And those could be pushed on. There's notifications, there's 30-day notice, all of that. So the way that the discussion ended and the way that the motion went through is that this ordinance was approved. And that is what we sent directly to SRO, and it was approved there and then was sent on to county board. So there was discussion and there was an offer of clarity added if needed, but after all of the discussion with it, what it ended up with was, let's just see how it goes with it just saying 200 feet, and we will edit if we have to in the future.
But we're saying 200 feet, that's the conversation we were talking about, and I thought Kathy was gonna go back and look at it and maybe change the wording to find it better. Are we talking 200 feet of the physical building or the property? Because the way the ordinance reads right now, it appears it just says brick, quote, brick and mortar.
Mm-hmm.
So I'm just asking because somebody else is gonna ask the exact same thing. And I'd rather have a little bit more specificity in the wording of that than to have staff having to start dealing with a bunch of people saying, well, I went out and took a ruler and I measured it and they're within 150 feet of my business. Well, reality is they're not. They're within 300 foot of the door or the wall, physical wall of the building. Because I guarantee you there's going to be some people that are going to bring it up.
Well, and that was all discussed. And if you as a board want her to add something, then she will. That's not a problem. We'll just have to reverse and basically go back. She can try to make, an edit that would be appropriate and then send it back to legal to review and then bring it back to you all.
I want you to understand, myself, I'm good with whatever you guys decided to do. It's just that my memory of the conversation was that we were okay with the overall ordinance. There was just a couple things in there that we wanted to have tweaked a little bit before the final presentation to the county board. But if we go with it the way it is right now, that's fine. If we gotta go back and change it down the road, but I'd rather try to make sure that everybody's on the same page from the get-go with this instead of going back 2 months down the road and saying, well, that's not really what our intention was. So now we gotta take an action to amend something. And, I'd like to make sure we're doing it clean.
That's up to you as a board. It's already been voted on, so I'm not sure how you want to proceed, but that would be for all of you to decide and direct me.
So what we voted on, the way it was worded last month is what was presented to county board. There wasn't any actual changes made on the document. Okay.
What was voted on was what she gave you, what she presented
Okay, that's fine.
as is. Yeah. You all just let me know and that's what I'll do.
Anybody else?
Are they moving? Are they supposed to be moving? Is that?
So if they are wanting to stay somewhere longer, that's where she was talking about that variance that they can apply for.
Okay.
That would be, and that might be where the confusion was, that the rule is in here, but there is the possibility to apply for a variance if the situation will qualify for that.
And is that at staff's discretion then, or is there a certain criteria that will meet a requirement for a variance?
I personally don't have the criteria memorized, but generally they would have to meet a certain criteria, but it would be to staff discretion.
Okay, but
based
I
on
mean, we
that
don't have
criteria.
anything in writing right now per se as far as what that may or may not be.
I mean, I can double check it right now
I
and
mean,
see if it's.
we can get it, Kathy can give that to us next month as far as that goes. I'm just, because I'm still kind of questioning some of that stuff myself. It's somewhat confusing. Because I was told it had to be a self-propelled vehicle, but then there's a food vendor that has a non-operational vehicle, so they can't hardly move from one week to the next if the vehicle doesn't run. So I'm just wondering if, how much are we going to enforce what we put in the ordinance? You know, how stringent are we going to be with the wording of what we put in the document? Because I had another person already brought that up to my attention, say, look, I got a food truck next to me and the thing doesn't even run, they had to tow it in here.
Yeah.
So that's, in my mind, that's not a mobile truck. And they definitely don't have the ability to move from a location from one week to the next if the thing doesn't even run. But I'm just giving it that as an example, because that's something that somebody will probably bringing it up.
So can the Macon County Board put stipulations on the food trucks, or is that over with?
I think that starts out here in the ordinances.
Okay, I didn't know.
Come to the board.
The variance
Time
section.
frame right now?
It's
on this, how long?
I think-
1 week,
Are they allowed to stay 1 week?
1 week.
The variance section just says, the health authority may grant a variance by modifying or waiving the requirements of this chapter if, in the opinion of the health authority, a public health hazard or nuisance will not result from the issuance of a variance. If a variance is granted, the health authority shall retain all pertinent information in the food establishment's file. A variance is non-transferable between owners. Variances can be applied for by following the steps listed in section 91.52 of the Macon County Food Sanitation Ordinance. So it doesn't list out criteria. It sounds like basically a variance can be granted if it's not going to cause a nuisance or a health
Will
hazard.
they be checked as 1, 2, and 3, just like we are, category?
Oh, yeah, the food, yeah.
What is a food truck? Is it one?
It depends on what they have.
Oh,
I mean, that would be, concession stand, for example. There's some that would be one category and some that would be another, depends on what they're trying to sell.
So
Or
the 1 week guideline, you can only be in location for up to 1 week in one spot. It really isn't gonna make any difference then, because they can apply for variance to stay where they're at as long as they want. So the ordinance doesn't really have any teeth in it from that regard, because I could say, hey, I wanna stay in this spot, and somebody else could say, no, you can't, because that's not fair to me, because I gotta move. I don't know. We need to either have it one way or the other. If you're gonna be a mobile food truck and you're gonna be mobile, which means you either can pull your trailer with a vehicle or drive it under its own power, then 1 week's 1 week. I don't think we should make accommodations for certain people to be able to set up a permanent location, because you know what? It's a permanent location, then open up a brick or mortar store and invest the money and the cost of the overhead and everything else, because I'm telling you, some of these food trucks, the way they're setting their shops up, they're almost a permanent structure. And I don't think that's what the ordinance is geared towards. It's geared towards somebody that's moving around. I've looked at some other cities, and a lot of the other cities don't even allow you not only not stay in one spot for a week, you're there for 1 day. And these places are using social media and other resources, and they're promoting their business and creating a following. I mean, last month it was talking about places around 48. I've heard they've got great food. I've never been there, and I know why I haven't been there, because they're on the wrong side of town. If they showed up on my doorstep one day and say, hey, can we camp out in your parking lot for a couple of days or a day, a week, whatever, I might say, yeah, go ahead, do that, because I think it'd be great for them to attract new customers and get their name out there. And I think, honestly, from a business standpoint, they probably would garner more business by being in different locations instead of being in the same spot. But you got, they're supposed to be mobile, so they should be able to pack up and go. They're putting in, provisions for power, temporary power being hooked up to a meter and things like that. That, to me, you're either mobile or you're not. And we're letting too many of these businesses that are kind of sitting on the edge of the fence. They want to be mobile, but they don't want to commit to a brick and mortar store. And I think that's unfair to our restaurants. And I think it's something that we need to make sure that staff is staying on top of. And again, you don't have a lot of resources, so somebody gonna go out and check these people and make sure they're not sitting in the same spot for more than a couple weeks at a time. Not too hard to do. If you drive around town, you see in the same spot, you know they're not moving. But I just question what we're gonna do when this comes up and we're saying you gotta pack up your stuff and move someplace else. These people better know this, if they apply for this permit, that means you got 1 week to stay there, and you're gonna have to be thinking about being someplace else. I think we need to fix this, because when they set up places, they're setting up almost a permanent structure. And that's just my observation. And I'm a food guy. I got nothing against these people wanting to do their thing and make money. But we're literally making accommodations to cater to them that normal restaurants aren't being allowed to do, with taking the food back and forth and heating and reheating and things like that. I personally think that's a safety issue. I think they need to do their thing, and they need to be moving out and about. I don't even know if there's gonna be a lot of people that are gonna participate in going out in 20-degree weather and setting up a food truck. I'd much rather go turn the key in a lock on a building and walk inside and turn the lights on and start doing my business, is to go out and do that kind of thing. So I don't know how much of a demand you're gonna get for a year-round permit, so I'm really curious to see how this goes. But I think if we put the ordinance out there, we're telling people that this is what we expect and that's part of the ordinance, then we better be prepared to stand behind it and enforce it.
How does the health department know where they're at to go inspect?
As far as with the food truck?
The what?
With the food trucks, you mean, like what their location would be? Honestly, I'm not sure, because for the unannounced now, as far as, like when they would apply, they would obviously have to have an address to apply, but I'm not sure when they do an unannounced. And I told Kathy not to be on tonight because she's off, so I can definitely ask for that question and bring it back.
That would be a big thing to know. How would you know where they're at?
I'm sure they have a way, because they're doing it now, but I just don't know what that is.
Surprise them like you do the brick and mortar, to come walking in and where they at, you know? Who knows where they're at?
I can ask.
How can they be putting up electrical?
They
do. There's,
put
I
it,
tell you, there's at least a dozen places around town. They've got a power drop with a meter,
yeah,
water, everything.
Well, I get that, but I'm saying,
on the
for a
phone.
week at a time, how the hell do they
I don't
have the money to afford to pay that to come down?
They get some work out the property or whatever, and they do it.
They're supposed to have their own personal generator to run things like
I mean,
that.
a restaurant's gotta have, hand washing, and they gotta have bathroom facilities and everything else.
My point getting to it is,
Food
if you
truck
drop
yet,
down
it's
there,
got
there's no
that.
way you're only staying a week.
Right. Well, the
There's no
idea
way.
of being mobile is to be mobile. That means you got a generator and you move your stuff around. Like I say, a lot of cities, they're not even letting them stay.
Yeah.
You camp out some spot for
4
a day,
hours.
yeah, you do your thing and you go on someplace else.
You have to be,
So I'm not wanting to add extra stuff to the staff to have to do, but if we're putting this ordinance out there and saying this is what the rules are gonna be, then we better be prepared to enforce them. That's all I'm saying. Okay, anything else on that?
Like, I need direction from the board on how to proceed with that. Because as of right now, it's supposed to go on the agenda for the December.
Honestly,
council
Brandy,
meeting.
I think we have discussed it as a board, we voted on it, it's gone to the county board, I say let it get passed. We will circle back with Kathy down the road as this stuff starts to materialize with applications and things. And if she feels like there's some issues that need to be discussed, then by all means, I encourage her to bring it back to our attention. But I'm just saying, if we're putting this thing in place, we better be prepared to stand behind it.
Well, we do with all of our.
I know, but I'm saying it's creating that extra work for the staff, and I'm trying to avoid doing that because they haven't had to deal with this during this off-season time. Now it's gonna be extra work for them to have to deal with, and who knows, you may only get 3 people that apply for this. It may not be that big of a deal anyway.
Right, I think there will be some that I'm hoping it's not going to be an extreme amount of extra workload because some of those that had the mobile food truck before would pull temporaries on those off months, where now they're just gonna be licensed through those off months, so they'll get their, inspection that they have to have, but they won't have to have an inspection for all of their temporary events, if that makes sense.
Yeah, because a temporary event, and I think that's where people get confused. I do temporary events because I don't have a food truck, so I pay per event for a permit, a temporary event, and food trucks, apples and oranges, it's not the same thing. So I think that creates some confusion for people because they don't understand that. Okay, appointments to committees.
Mark, just real quick. So
Okay.
we're just gonna proceed as we were and ask county board to vote on
Unless
it.
somebody else has an opinion to do something differently, I say we leave it alone and we'll come back and make modifications as either we see needs to be done or staff comes
Okay.
back and says we need to take some action and change this.
All right, sounds good.
My concern was whether or not we changed the document from the time we voted on it till we got the county board. So, appointments to committees. Right now, we have an opening on the nominating committee, and we have 2 openings on the bylaws committee. And we want to get that done last month, but Vivian only got 2 volunteers for one of the committees, so we still have 3 slots to fill. The nominating committee is primarily made up to review board members for their activities and make recommendations for replacement for vacancies. And then the bylaws committee, of course, reviews the bylaws and makes recommendations to bring to the board for any bylaw changes that we need to vote on, take action on. So those are 3 spots that we have open right now. I'd like to see us get those filled going into next year. Especially the bylaws committee, because we only have 1 person on there right now.
So Mark, the 2 blank spots on the personnel committee.
That's you and I, because
Okay,
we both volunteered to do that last
Okay, well,
time.
I wasn't sure because it wasn't filled
Yeah.
out.
I didn't add them on there because we hadn't voted yet, so I did have in the minutes that you 2 had volunteered, it just still needed to be voted, like the appointment for that. And then the other spots, of course.
So, like I
Yeah, I'd volunteer for another committee, but I don't want to take away from anybody else that wants to potentially.
I don't have a problem doing that with the team, so.
What's your preference, Dr. Jurger, nominating committee or bylaws?
If you only have 1 for bylaws, I'll go there then.
Okay.
We need slots for that.
Okay. So we need 1 more for nominating committee and 1 more for bylaws. Mr. Parks is relatively new. We can put him on a committee since he's not here tonight to oppose it. That's the curse of not showing up to meetings.
There you
That's the
go.
way it's always worked on the board I've been on.
Yeah,
Not show up to me, you're gonna volunteer for something.
We'll nominate him for the nominee.
There you go.
Okay, we're gonna put Cody's name down, and then if he rejects it, then I'm sure he won't.
1 more spot.
1 more spot, need somebody for bylaws.
Legal reviews those 2, so it's a relatively easy.
What are the times that they meet? I can't meet in the daytime, so.
They don't regularly meet. Usually what happens is if the board proposed a change to the bylaws, there may be additional conversation, but generally our bylaws have just been reviewed by our legal, and then they say if there's something to change, and then it comes back to the board. So usually there's really not much that the bylaws committee does.
I would say if you desire to be on that, then you would state that can't be before 5:30.
That's based on your availability.
Yeah.
Well, and Dr.
Which I can't either.
And Dr.
Dr.
Minigotti's
Minigotti's on that too, so he's in the same boat.
Well, it's just that when you ask for, like a special meeting, I can't ever do that. So that's why I was reluctant. I'll do it if meetings aren't.
There's not
Set
a
time in the daytime, or we can do it by, online, that's fine too.
Thank you. All right. Do you want to do the vote on that this month then? Since you have, or do you want to wait till December? December, they're usually done, but we can do it tonight if you want to, as a board.
Well, Cody's not
Yeah, you
here.
could always do the vote with an exception for Cody to confirm that. You can talk to him tomorrow and figure out if yea or nay if he wants to or not.
Cody.
I'm good with voting on it, unless anybody else has an objection.
Agreed.
Okay, need a motion to vote on the appointments committees.
I'm making a motion to approve the
Slate as presented.
slate as presented.
I'll second.
Okay, roll call.
Mark Scranton,
Yes.
Jane Hack,
Yes.
Jeff Emler,
Yes.
Debbie Hill,
Yeah.
Dr. Brent Dringer. Dringer,
Yes.
Dr. Janet Patterson,
Yes.
Thanks, everybody, for volunteering. Okay, new business, approval of Macon County Board Resolution approving increased appropriations for FY 21-22 health fund budget for Delta Dental of Illinois Foundation.
Sheree is going to go over this part.
Okay, I will cover this one. Okay, so this is a grant that we applied for with the Delta Dental of Illinois Foundation. We received the grant for FY21 and FY22. For FY21, the funds are being used to support the salary of the dental director. So we are only adding revenue to the budget because the expense was already in place in the approved FY21 budget. Then for FY22, the funds are being used to supplement current salaries and fringes, increase current staffing levels, as well as the cost of a cloud-based dental software. Most of that expense was already in the budget as well. So we are adding the revenue of $133,000, and then the only increase in expenses for FY22 would be the cost of additional staff to help support the clinic. And that the salary and fringes there total $33,000.
Sheree, you cut out. Give us 1 second. The computer turned off.
Okay.
Oh yeah, I think it just timed out because it just says check the cable connection.
My screen is frozen also. I don't know.
Oh, it's hot. That's what the mic. I think it's just been. She said. Oh. Okay. Here. All right. Go ahead, Sheree.
Well, what did you hear last? Where should I start?
The last thing we heard was the cost of the cloud-based dental software.
Okay. So sorry. So I said for FY22, it will support current salaries and fringes, increase current staffing levels, as well as the cost of cloud-based dental software. So for FY22, we are adding the revenue for the full amount, $133,000. And then the only expense that is not in the budget already would be $33,000, which covers the additional staffing that we are going to put into the clinic. The rest of the expense was already included in our normal FY22 budget.
Any questions about any of that, the resolution part? Thank you, Sheree, and kudos to our staff. And that is the grant that we've been kind of talking about. Thanks, Sheree. So that's it on that part.
Okay, does that cover the software agreement too?
I mean, we can do those. Do you want to vote on them separately, or do you want to?
Well, let's go ahead and vote on the first one first. So the approval for the Macon County Board Resolution approving increased appropriations for FY 21-22 health fund budget for Delta Dental Illinois Foundation. Need a motion for that?
Make a motion.
Second. Roll call, please.
Mark Scranton,
Yes.
Jane Hack,
Yes.
Jeff Emler,
Yes.
Debbie Hill,
Yes.
Dr. Brent Dringer,
Yes.
Dr. Janet Patterson.
Yes.
Approval of dental software agreement.
So moved.
Any discussion?
Just if anybody has any, well, I do have some stuff. So I gave you. But, this is actually something we got turned around really quick. Once we found out we got the grant funding, then this was the cloud-based software that that was mentioned when Sheree was talking about the resolution. But then, now that we know we have the money, we'd like to move forward with it. So I did send the agreement to the state attorney's office to have them review it. As a reminder, as we talked about before, not every contract has to go to Mike or through the whole entire county board process. There's certain criteria that would make some eligible to have to go through that process and some are not. Because this was a new contract with a new company, I wanted to make sure that it was rather be safe. So the copy that is in your packet, we've had a couple small edits to that. So I put paper clipped on your staff or next to your staff a different one, so it will be all by itself. That is the updated one. The changes from the one in your packet are fairly simple. Mike Baggett did ask the company to change wherever there was a reference to the state of Minnesota. If there was some kind of, litigation or anything, they had state of Minnesota. So he asked for that to be changed to Macon County, or law of Illinois, basically. And so in the old and new document, that language is on page 4, section 9. In your old copy, it just says it's governed by the laws of the state of Minnesota. And then on page 9 in section 8.2, it also references Minnesota. So Mike got back to me really quickly and I asked the company if they could quickly just change it and be agreeable to that, and they were. So they changed it to, in your new copy, page 4, number 9, miscellaneous, they did change to agreement shall be governed by the laws of the state of Illinois, and the venue will be in Macon County. So that was changed. The other small change is on pages 1 of 13, that's labeled on the bottom, so where you start to see the numbers for the price.
You said page 13?
Page 1.
Oh, page 1.
Yeah, sorry, page 1 of 13. So on your old copy, in the price, you'll see that it says 1 dentist. In the new copy I gave you tonight, it does reflect the 1 full-time dentist and 1 part-time dentist that we have here 1 day per week. And then you flip that page over, so then you're going on to page 2 of 13. And you're going to see that our new copy is slightly more than the old. Very, very slightly. We got more discount on the new copy, on the new proposal, basically, that they updated to have both of those dentists in there. But it is a little bit more just because of that increase in the number of dentists that we have. Does that make sense? So those are changes. They're very minimal. So we hope that with these amendments that you'd be agreeable to vote it through so that we can move this through the county board process and get this dental software through. If you don't feel comfortable, obviously, please say that. And if the board chooses not to vote, then we'll follow that. But they made the change that legal requested. Legal had no other changes. In that grant that we got, we had put in up to $10,000 for cloud-based software. You'll see that our initial payment that would be due would be $2,868. And then there's a monthly cost of $278. So that still puts us well below the $10,000 in grant funding that we were able to secure to cover the cost of this.
Dr. Jordan, are you familiar with this type of software? Is this something we definitely need to have? And does this look like a good program?
Yeah. That's a good company.
Okay. That's good enough for me. Any other discussion? Roll call then.
Mark Scranton,
Yes.
Jenny Hack,
Approved.
Jeff Amber,
Yes.
Debbie Hill,
Yes.
Dr. Brent Jenger,
Yes.
Dr. Janet Patterson.
Yes.
Closed session.
Before we do a motion, I did want to, to just all of you, I was going to say in reflecting, if you want to review the minutes and there are no edits and you want to go ahead and vote to approve, you don't have to go into close. But if you review them and anybody feels that there needs to be additional discussion, then we can go close. If the board is agreeable with that, I just thought that way to handle it, if we're just looking at only these minutes. We need to have conversations going to close.
No one's talking. Oh yeah, no one said anything for a while, that's why.
So that's for a motion approval of the minutes. Paul?
Mark Scranton,
Yes.
Dan Hack, Jeff Emler,
Yes.
Debbie Hill.
Yes.
Dr. Brent Jenger,
Yes.
Dr. Janet Patterson.
Yes.
Third.
So moved.
Yes, I'm.
Second.
Roll call.
Mark Scranton,
Yes.
Dan Hack, Jeff Emler,
Yes.
Debbie Hill,
Yes.
Dr. Brent Jenger,
Yes.
Dr. Janet Patterson.
Yes.
Cool, good night.
Thank you, everybody, for being on. Have a good rest of your night.
Yes, Mom.
You want me back?
Just the close.
Yeah.
Years,